plan in your county, how are you aligned to these two national level frameworks? Thereafter, when you come to the County Government Act provides that we must have county special plans. And if your county has urban areas, then you must have urban plans. Then you have a county sectoral plan, which is 10 years. That's a requirement in law. And thereafter, we must have the county integrated development plan. Then we have departmental plans. And as we do this, this must be aligned to the national government plans. So the national government has what we call the medium-term plan, which is a 5-year plan. So currently, the Kenya government has what we call the third medium-term plan of Vision 2030. That plan is for 2018 and 2022, which is ending next year. And the county governments have what we call the second integrated county development plan, which is to be aligned to the medium-term plan. So specifically to the subject we're discussing, if you look at the Ministry of Health or the Department of Health in Meru County, ideally, you should be having a 10-year health sector plan. Then you should also be having a 5-year health sector strategic and investment plan, which must be aligned to the CIDP and then aligned to the medium-term plan. So in your meeting this morning, ask yourselves, does your county have a 10-year health sector plan? If it does, what does that plan say in as far as mental health is concerned? Do you have a 5-year health sector plan? If it does it have a specific objective or mental health for that matter? At the lower level, as the national government develops the annual work plan for various ministries and departments, the county government develop the county annual development plan. Now, these plans are important because it's what informs the budget. So you can see down here, if you move from the planning framework to the budgeting framework, then you see how all the plans are linked now to the county budget process. So the key thing now, colleagues, is that if your plans have not integrated mental health and disability related priorities at objective level, there is no way they'll be included in the plan in the budget. So the action point I'm recommending for you, look at the sectoral plan. Look at the county integrated plan as it is now. Look at the 5-year strategic plan for every department, say the Department of Health or Department of Social Protection or Education, and check whether those plans have integrated mental health. The challenge is mental health being a unique strategic focus area. If your county does not have a county plan of action for mental health, then you will find it very difficult to integrate the mental health issues into these plans. So it's allowable to have a plan of action, and the county plan of action for mental health, if you have one, should be costed. The moment you have that costed, then it means the Department for Health will draw their mental health priorities from the county plan of action for mental health. The Department for Education will draw the education priorities specific to mental health from the county plan of action for mental health. The Department for Gender will draw their priorities from that. So yes, we could have all this planning framework in place, but mental health, if you look at the national plan of action for mental health, it largely recommends the county to have a county costed plan of action for mental health. So this is briefly what I can show you in a snapshot in as far as the planning framework is concerned, and all these provisions are available in law. Let me now show you very quickly the budgeting framework. And if you can see on your screen now, let me just hope it can be a little bit enlarged. The budgeting framework, there is both national and county. And for this meeting, I want to restrict to the county framework. So the county framework is guided by the Public Finance Management Act. So the responsibility to guide the county government to budget at the county level lies with the county treasury, and the county treasury is headed by the chief, the county executive committee member responsible for finance. So normally, when the development plan is available, then the process starts with the development plan being approved by the executive. Now, once that development plan has been approved by the executive, it's then taken to the assembly for another approval. Now, that is called a strategic phase. And once the development plan has been approved, then we go into the details around what resources do we require? Does the county have some debt that should be paid? What are the sector working groups in the county? Are the sector working groups confirming that the plan as submitted to the county assembly is what they recommended to the county assembly for that matter? Then you begin to see from the strategic phase, which is more of planning, there are certain terminologies you begin to see here. You see CBROP. CBROP is basically county budget review and outlook paper. And then you see county fiscal strategy paper. I'll be showing you shortly how you can be able to engage and influence these documents. So from this strategic phase, you now move forward to operationalizing the strategies in terms of resource allocation. So here now we prepare the budget. The preparation of the budget starts with the department, and therefore, if you're talking about allocating resources for mental health or disability-related affairs or for inclusion, the department responsible has the responsibility to budget. So anytime we say that this department did not budget, don't blame the county executive. Actually, the blame begins with the sector members of the health sector who might have failed to budget for the priorities for mental health. Once that has been done, budgeting, the budget estimates will proceed to the assembly. The assembly will approve them. There's a whole process here in the assembly, including scrutiny, public participation. Now, when the assembly has approved the budget, there's a law that is called Appropriations Act. So whenever you hear the assembly has approved the budget, don't take a budget report approved by the assembly to be in approval. The assembly must pass a County Appropriations Act to allow the executive to spend. Now, for the county to raise money, the county assembly must also approve the county finance bill. The county finance bill shows how the county will raise its local revenue. And even if the budget is approved, sometimes they need to amend the budget. And when you're amending the budget, that's what you call supplementary estimates. The cycle continues. When the budget has been approved, there has to be a cash flow, and I'll show you shortly what that means. There's implementation going on, there's the reporting and oversight. So moving from this now, I want to transition to what are the specific entry points for you in your county. And the next slide I'm showing you, I have more of PDF documents because the content is a bit larger. Maybe you can confirm what screen you are now seeing. Are you seeing how to engage the county budget? I just want to hear someone confirming that.
Yes, we can see that.
We have specific dates by which specific things must happen. Now, the Public Finance Management Act provides that by 30th August, the County Executive Committee member for Finance will issue a circular to set out guidelines to be followed by all of the county government's entities. So what you need to do, because 30th August Elisha Peter, all of us in this workshop, we need to get a copy of the circular. So what we are recommending here, acquire the circular from the CEC Finance, disseminate to your staff members in your offices, to communities and even partners. So what you must check in that workshop, how many of the participants in that workshop have seen a copy of the Meru County budget circular from the CEC, either previous years or the current year. Now, that circular will show you now the detailed dates of how things are happening in your county. And I'll show you your Meru County circular shortly. Then it also tells us that by 30th September, the county treasury must prepare a county budget review and outlook paper and submit to the county executive. Now, in 2 weeks' time, you should be having your Meru County budget review and outlook paper. Now, the budget review and outlook paper, what it does, it basically shows us how the county has been able to mobilize revenue or collect revenue, and how the county is implementing its budget as was approved, and how the county is making projections on the next financial year. So again, your responsibility as partners or government officials, make sure you have a copy of the budget review and outlook paper. Disseminate it to your colleagues. Now, the county budget and budget review and outlook paper is supposed to be approved by the county executive committee. So the CEC Finance will take it to the county executive committee. The county executive committee will approve it. So anytime you are looking at the county budget review and outlook paper, don't rely on what someone sent you through an email. Make sure the one you are looking for is the one that was approved. So 2 weeks from now, again, I remind ourselves, let's get hold of the county budget review and outlook paper. It shows us how the county has been collecting revenue, how much revenue came from national government, how much you collected from local people. It shows us how much you're collecting every quarter based on various revenue streams. It is showing us how we are also implementing. It's also showing us the projections for the coming years. And if there are economic outlook issues we need to take into consideration, then that document provides that information. Now, the budget review and outlook paper must also be approved by the county assembly after approval by the cabinet. So when this is all going, as you get the outlook paper, use it as a basis for monitoring the county budget implementation. So the point I'm making is this: because this is not the first year that Meru County government is implementing a budget, you can start by asking, where is the copy of the budget review and outlook paper for FY 2019-2020, for example, and what did it have? And that budget and review and outlook paper, did it explicitly provide any mention on mental health or disability related issues? Then further to that, if you see my right, there's normally what you call county budget implementation report. You can get this from the Office of the Controller of Budget through their website, or in every county, the Office of the Controller of Budget, though it is an independent constitutional office, they have assigned a particular staff. So there's a Meru County Office of Controller of Budget with a staff. You can visit that office. They will give you a budget implementation report on how your account is spending. Because the last financial year already ended on 30th June, already we have Meru County 2020-2021 annual budget implementation report. You can look at it. What that report does, it will show you how the Ministry of Health or the Department of Health has been spending. It will show you the programs. If there has been allocation on mental health, for example, disability, how did the ministry spend that money as was allocated to them? So there's a document that can make you see that. Now, this is more of budget specific heavy. However, in terms of planning, by 1st of September, which was 2 weeks ago, the county executive committee member responsible for planning needed to submit the development plan to the county assembly. So because today is 16th September, in that meeting, in this workshop where we are, how many of us have a copy of the annual development plan? And the annual development plan we're talking about here is for the next financial year. So we are supposed to get this plan, disseminate it, and we can use it for the subsequent reference the budget process. Now, this annual development plan has several sections. There's a section for health, there's a section for education, there's a section for water. So you can narrow down to the section for health, for example, and check, do we have development projects that are going to help us address mental health issues? For example, if the mental health department require equipment, there are equipment or maybe assessment centers constructed, do we have a budget, a proposal in the annual development plan that shows that a proposal has been made to be approved in the plan that the county will construct a mental health assessment center, for example, or if persons with mental health challenges that require assistive devices or disability, persons living with disability that require assistive devices, has this development plan included an intentional plan to procure assistive devices, for example? So you have to interrogate that development plan. So right now it is 16th of September. This plan by now should have been approved by the assembly. Now, the moment we move away from planning, I want to just give a question here that the county fiscal strategy paper and the county debt management, this is the law provides for 28th of February for these two, the county debt management strategy and the county fiscal strategy paper. However, because of elections, the national government has already proposed that can these things be done in the months of November, December. So ordinarily, by 28th of February, you'll be having what we call the debt management strategy, the county treasury to submit the debt management strategy. What it does, it shows you the debts that the county is having and how the county is planning to pay those debts. You have to look for that document and check, is our county having some debts? And how is the county servicing those debts? After the debt management strategy, we have a policy paper here known as county fiscal strategy paper. And I want us to be more now on this matter. The county fiscal strategy paper is a policy document. What it does, it provides policy proposals to the county assembly on what should be prioritized when now looking at the budget estimates. Yes, we have the annual development plan approved, but still the executive must say, yes, we have approved the annual development plan, but these are our policy priorities. When the county government is developing the county fiscal strategy paper, the national government is developing what we call the national budget policy statement. So the county fiscal strategy paper must be aligned to the national budget policy statement. If we have mental health and disability or inclusion related matters explicitly provided for in the county fiscal strategy paper, it means the resources will be allocated for them. But if they're not explicitly provided for here, they will not be allocated. So we need to be on the lookout in the next month, October, November. When the county treasury is preparing the county fiscal strategy paper, we must engage with them and ask them to provide a substantive paragraph on a policy statement on mental health, disability, and inclusion related matters. We will review that document ourselves as stakeholders before it is taken to the county assembly. Because if we don't review it, the county assembly sometimes have no time and they'll go ahead and approve a fiscal strategy paper that will not include mental health issues. Secondly, the fiscal strategy paper sets the ceilings for every department. So when we are saying Department X is allocated this amount of money, Department Y, the county fiscal strategy paper will tell us which department has been given what ceilings. And once the departments have been given ceilings and approved, then now they can present the budget details based on those ceilings. So this is a critical moment for me. And I think it's also for you. Plan and make sure you are directly involved in influencing. This is a great opportunity, the county fiscal strategy paper, right? And see what we are saying. Review the fiscal strategy paper and generate key issues that will inform your budget. So review the fiscal strategy paper, the issues that you like, that you want to support, present those issues and say, in the fiscal strategy paper, we are supporting these issues. The issues that are missing, list them properly, and present a recommendation in a memorandum. Take these ones to the county government. Then take the same memorandum to the county assembly to follow up. Civil society organizations or NGOs for that matter oftentimes can help, because you can imagine you are a department director of government and you want to start challenging the CEC of health, or you are the CEC of health and you have struggled to negotiate for the budget at the executive level and you are not succeeding. It is important for the civil society now to come to your rescue, because the CEC health, the CEC education, the CEC finance will sit in a meeting chaired by the county governor. That CEC meeting will approve the fiscal strategy paper. So if the CEC health perhaps has tried to advocate within the government spaces and he has not been heard, it means the civil society voices and faith leaders' voices is the only alternative that can now be heard. That is why it is important for civil society to develop memorandum. In government, a government department cannot develop a memorandum to its own government. The government departments will just develop plans, they develop targets, they develop proposals. Civil society and the public are encouraged to do memorandum. So after the fiscal strategy paper, the next opportunity we normally have now is a real budget. So between February and April, normally when the fiscal strategy paper has been approved, then the departments are now told to do the detailed budget. But this is likely to happen earlier. In fact, there's a possibility that the national government will have the budget policy statement approved by November, and then by February next year, they'll have the budget for the next financial year approved. So the county assembly might also go the same route. So when you look at what we have here, it is important that mental health or disability experts please provide technical assistance on budgeting for mental health issues, because the economists or the planners may not be experts on budgeting for mental health issues. And therefore, if you already have the Meru County costed plan of action for mental health or disability, then that is the document you make reference to when the budget is being made. So the technical support we are calling for here, you literally must go to the sector working group meetings at the county, maybe the Ministry of Health or the Department for Health Sector or Education, and sit through those technical processes. And when budgeting, the details that you must confirm. The first number one that you must confirm, is there a specific program that is for mental health? In the health sector, there could be a preventive program, curative program. My recommendation for you in Meru County, make sure you have a specific program under the Department for Health known as mental health as a program. Now, under mental health as a program, there has to be an outcome. What outcome do you want to achieve? Under that outcome, what is the indicator you'll use to measure that outcome? Then, what are the targets? Then after the program, go to what we call sub-program. Sub-program 1 under mental health will be prevention. Sub-program 2 will be response. So if you take sub-program 1 as prevention, what is it that you want to present as outputs on prevention for mental health challenges? What are the indicators you want to measure? What are the targets? In terms of response, what are the outputs you are presenting to respond to mental health challenges? What are the indicators? What are the targets? If that is done very well, now the budget is specific to the program, to the sub-program, to the outputs. So failure to have outcomes, outputs, programs, sub-programs, targets, and indicator done very well basically means you're failing to budget properly. So you really need to put a lot of effort as a stakeholder in that workshop. In the next 1 year, for example, how do you want your county mental health program to look like? What outcome do you want to agree on? What are the outcome indicators and targets? What is your prevention sub-program looking like? What is your response sub-program looking like? That will help you now engage with the stakeholders at the technical level, Ministry of Health, or Department of Health, Department of Education, Department of Sports, all relevant departments that have a responsibility of mental health and disability, you need to engage them, influence those programs, sub-programs, and targets. As you do that, do not forget two documents. Those are previous documents we talked about called Annual Development Plan. There's another document called County Fiscal Strategy Paper. So if the Annual Development Plan did not provide for mental health and disability, if the County Fiscal Strategy Paper did not provide for mental health and disability, at this stage, the County Executive Committee for Finance or Treasury can actually reject your proposal because they are not aligned to the previous document. So the Annual Development Plan, the County Fiscal Strategy Paper must first of all recognize mental health as a priority area before you budget. Most importantly, the other plans we talked about. There's a national government medium-term plan. There's a Ministry of Health at national government level, which has a mental health plan. There's a county integrated development plan. There's a county sectoral plan. So all those other previous plans inform the subsequent things that we are doing. So it doesn't mean that when you present your memorandum at the budget level, raising concerns, those concerns will be taken. The reason why those concerns sometimes are not taken is because they're not aligned to the previous policy direction of the county. So we have also given you here what you can do. Technical assistance to the department is critical, and budget advocacy is not going to the streets and carrying placards. Budget advocacy is basically technical influencing. If you do your technical influencing very well, you are likely to succeed. You can take all the MCAs for all manner of workshops you want to do, but unless the technical influence has been done, the MCAs will not put the technical content. For the MCAs, they'll do the political responsibility in the county assembly of approval. The county assemblies do not have a technical department on budget. The National Assembly has what we call the National Assembly Budget Office that provide technical assistance to the Senate and the National Assembly on reviewing the budget. The county assemblies do not have that technical department. They only have clerks. So yes, at national level, you can go to the budget office in Parliament. It has a team of about 20 experts with a director, and they can listen to you technically. At the county level, when you go to the county assembly, you will find MCAs who might have a challenge in technical understanding. So emphasis again, budget advocacy is more of technical influencing at the right time. So we're also recommending for you to build public support of the citizens from the grassroots of the community. You may need to adopt a culture of doing the analysis first and simplifying this analysis to the county assembly members, and also developing citizens' simplified budget for the public. Meaning, right now, you can take the current government budget for Meru County, synthesize it, isolate what is providing for health or education, isolate what is there on mental health, isolate the gaps, and popularize it among the public. If you popularize among the public, before you know it, the public will be the people raising these concerns to the county leadership on mental health. So that is the opportunity. So maybe in about 5 minutes, Sam, I just want to mention other important things. Even if the budget is approved, there's something called cash flow projection. Cash flow projection, what it means, it shows how much money every department will be receiving every month. So assuming that mental health priorities have been approved in the budget, it doesn't mean the money will go to the Department for Health or the Department for Education. So at the Department of Health, you must show how much money do you need every month and for what. That is what we call the annual cash flow projection. So the stakeholder in this workshop, the law requires that by 15th of June every year, there should be an annual cash flow projection. So my question would be, now that the Meru County government is implementing the financial year 2021-2022, have you seen the annual cash flow for the Department of Health or Department of Education? That annual cash flow will show you how much money is to be spent every month. The annual cash flow goes together with the procurement plan, meaning if the budget allocated for construction of an assessment center, for example, the annual cash flow as indicated, this will be done in December. Is the procurement plan also showing this will be done in December? So that's a very important thing that you need to take advantage of. Now, the approval process, like I said, it has timelines, which is 30th. And most of the time we talk about the appropriations bill as the evidence of approval. So I think I've done about 35 minutes so far, but I have just one last piece, just to make us see the realities now in Meru. Like I said, the Meru County budget circular. Maybe in that room, maybe Sam or Ben, you can take stock of how many people have been able to see the Meru County budget circular. But before you go to the budget circular, I had a chance to just show you something that is a gap in your county in terms of budget that you need to cure. If you see on your screen, the document in your screen now is the county budget estimates for the previous financial year. And you can see clearly, this is submitted by the deputy governor, who's also the CEC. And as they submit this document, they're saying that please find attached the budget estimate for the financial year. What they have failed to do, the law requires that you present the budget estimates and related documents. So in this case, they've just presented the budget estimate. Related documents are so many. Number one of the related documents include a report of public participation or a report of stakeholder consultation. It also includes a report as to whether the county executive has implemented the recommendation of the assembly of the county fiscal service paper. And as they do this, they copy the controller of budget and commission of revenue. So one of your gaps as a county is that you might be having a problem of submitting all the required documents if you go by this example of this letter. Secondly, if you look at the way the budget is presented, I want to give an example of the health services. If you go to health services, I think it's page 37, if you're not wrong. Yes, let me put the view, the rotated view. Yes, so you begin to see that your budget is more of a line item as opposed to program-based budget as required. Let me just go back to the first page. Okay, now you begin to see here how your budget is organized. Department for Health. So we have the county assembly, we have the office of the governor, we have agriculture, water, and health. So where we have a problem at this level, you need to begin to see the programs and sub-programs. But what this means, the details are not presented. It's just compensation to employees, which is basically human resources, around salaries, use of goods and services. These are more recurrent expenditure and development. So the detail around what this means, including what this development means, seems to be missing. And if you trace it even into the subsequent departments, you'll not be able to see what I'm talking about. I just want to make sure we get the one for health. That's finance and economic planning. Let me get and see whether it will give us the page. It's supposed to be 37. Okay. This is gender. Okay, let me take an example of gender. Gender, social development, and children services is assumed could also be having prevention and response kind of programs for children, maybe child disability or children with mental health issues, like access to education in early childhood, which is a functional count. Look at access to education or access to pre-primary school for children with mental health challenges. Now look at what we are seeing here. You can't trace even assistive devices as something that the county wants to investment. You can't even trace an assessment for children with mental health or disability challenges. So if you look at these details, it is still lumped up in a manner that you cannot see exactly what is this for. You know, this is the education and gender program, I think. Now, you have something called personal disability program, but we don't know what is it. See clearly, there's a budget personal disability program. In the current financial year, it is estimated as 10 million, and the approved by the county executive committee was 10 million. I think this is the previous one. Now, this year, 2021, 2022, it's expected to be around 10,267,000. But what this program details are, you can't trace it in this budget. So as to whether it's going to buy a vehicle, you don't know. As to whether it's going to provide resource materials. So what you must do as a technical committee, make sure you advocate that the presentation of the budget, including this program, provides details for you to know what exactly this 10 million is going to be spent on. So that is part of your technical budget advocacy. So let me see if you can quickly get the one for health. So on health sector, you begin to see you're going to see very interesting things. This is the health sector services, and this is the budget. So we have salaries, allowances, uniform. All this is important because health sector should have more recurrent because it's personnel heavy. However, when you scroll down to what I was calling program and sub-program, look at the details here, use of goods and services. Look at all this, supplies. There are several things that have been put here. Just scroll down with me. We are done with preventive services. Now you're on curative services. Look at what we have: medicine, dressing, chemicals, all those things. Going down, then you have development. Under development, you have just conditional grant for leasing medical equipment, other infrastructure. You can imagine you have a budget of close to 57 million, just written other infrastructure and civil works. You don't know what these things are. You know, you have a World Bank loan, 39 million. You don't know whether it's for mental health. So it's important that as a technical team, you advocate for your government to present a budget with the details that can enable you to see exactly what you're talking about. So thank you very much for listening. Let me now give it back to the moderator. I'll be happy to take your comments or your questions because we only have 20 minutes to finish. Thank you, and back to you.
Thank you, Elijah. Because you are not very near, we will not give you a big clap and a hug. So, bad like me, tumeshukuru sana. I want to open it up for questions. Yes, you can say your name and what you do.
Thank you, Elijah. My name is Rukwaro Simon, Monitoring and Evaluation. I think the presentation that you have done is quite enlightening. One question, having to with my understanding of the budget process and the situation in Meru County, I think what you have just mentioned is something that you have been working for quite some time, trying to sensitize the various stakeholders on the need to adopt the program-based budgeting. But when it comes to the level of the county assembly and the executive that is concerned with forwarding the final budget for approval, I think it has been a difficult task to be able to adopt the program-based budgeting, even though at our level we do the program-based budgeting. So what I would ask is, do you have a sample of what you have alluded to as a program-based budget that have ever been submitted to the controller of budget or to the at that level, national level, that we can probably be able to use in future while preparing or rather while advocating for the same?
Hope you got that, Elijah.
Yes, I got that. Maybe I can take two more.
Yeah. Kuna mwingine akona swali?
Yes. I am Daniel Meru, the economist for health. And I also would like to appreciate you for a very elaborate presentation that you have done on where we can be able to engage on so that we can be able to improve our budget for mental health and other programs. And my question is going to go at the point of submitting the budget estimates to the county assembly. Remember that the point of engagement with the stakeholders and the public is not only at the point of submitting the budget estimates. We need to engage with the stakeholders and the public at the point of drafting the ADP and also at the point of the sector reports and also the CBRO. My question is this: why is it mandatory that you have to attach the stakeholders' submissions and the report of public participation together in the budget estimates? Thank you.
Kuna mwingine akona swali? Unaweza karibia kwa sababu microphone papa.
Okay, maybe the third one.
Yeah, she's coming over close to the microphone.
The annual work plan and county physical strategy. Now that we have already started our budget, and the budget cycle for the year 2021-2022 has started. It's possible for us to.
I can't hear.
Sorry. Okay, just a moment. I can move this.
Okay. I have a question now. Now that we have started the budget cycle for 2021-2022, is it possible for us to have this mental health and disability issue incorporated in the budget? Number two, I want to confirm that there is already a policy for disability mainstreaming in Meru County. It is in Department of Education and Gender. So that one we have. So I don't know whether we are supposed to do another new policy on disability, whereas we already have one which is approved by the County Assembly of Meru. The other question is, when you talk about the budget issue, the programs in the budget, you realize that we give an example of gender where they have a budget line on disability issues, and they have given it 10 million. I think it's not possible to have all the small details in the budget. Then the budget will be very bulky. The small details in the budget, because how many books shall we have incorporated in the budget? If we included, if this you are going to buy wheelchair, you're going to buy other assistive devices for disability cases, so it becomes difficult. So I think that is why they usually do it together, and they use the funds according to the need assessment. Thank you.
Elijah, today, who is the focal person for mental health wants to add voice?
Thank you so much, Mr. Elijah Obonyo. My name is Patrick Mutabe. I'm the mental health coordinator. Thank you for that wonderful presentation. It is actually a high opener to us. So I have two questions. Now that we already have a policy in place, as you heard from our director of public health, that we have a policy for mental disability. So I was wondering, should we have a separate policy for mental disabilities? Because when we talk of disabilities, it is general. It is both the physical and the mental disabilities, maybe. So should we have that one which is clear for mental disabilities? And should it be aligned with the mental illnesses? That is one. Number two, you talked of there's a discrepancy when it comes to submission from the county department of treasury and all that. This could be due out of maybe design or default. If it is out, it is out of design and not default. How do we chip in? Thank you very much.
Okay, I think you can check on those, Elijah.
Maybe Sam or Ben, can you hear me?
Yes, we can hear you now.
I want to start with a question around the budget being very detailed. And I want to confirm that, yes, the budget has to be detailed. It has to be very many pages, and there's no shortcut. Are you seeing my screen, Sam?
Yes.
This document is 946 pages, right? Are you able to see this?
Yeah, move it. We can see the Kenyan program.
No, at the top.
Yes, 946. Yes.
This is the budget of the government of Kenya for this current financial year. So this is a standard. There's no other shortcut. In fact, there are more documents that are more detailed. So this document, you can see clearly, is the current budget ending June. Now, if you look at why it is detailed, the head of state, office of the president, already is the number one here. And I want to show you an example of the details. These are just summaries of ministries. So we want to go to the details of what you see, what must go into the budget. So these are just summaries to make people know what to expect later on. So this is a standard and this is a format. So the national government format in terms of the outline of program-based budget is the same as the county government format. So the question on the format and the standard is what I'm showing you. So look at this. This is the head of state's office budget. And you can see clearly, I want to show you his programs at State House. You can see he has a program and objective. And that is the deputy president's program, for example, including Nairobi Metropolitan, which is now under the head of state. When you proceed down, each of these programs, like the cabinet office, has an output called cabinet policy memoranda, a number of cabinet policy memoranda, 12 reports, conducive working environment, and the indicators there. If you look at all these details, you will appreciate what you need to be having in your county. So now, because we have seen the head of states, let's go to health. And to make our work easier, I want us to quickly search. If you click Control F, we can be able to search for mental health. Mental health. So we begin to see under the Ministry of Health, under the National Referral Services, we have Madari National Hospital with an output and key performance indicators and targets. That's the first thing you begin to see there under mental health for national government. The second area you see under mental health, we have again modernized wards and staff houses in Madari Hospital. The indicators there, number of patients again is there. Then further, you begin to see under division of mental health, we have awareness and capacity for priority mental health interventions, number of CHBs trained. So in your county, you need something like this. So there's no shortcut. The budget document has to be that detailed. And I can give examples of a number of counties that have made their budget details very budget more details. And the budget must be readily accessible to the public. The National Treasury, let me just show you why we are saying the standards have been set and the county have no shortcut. Maybe some, if you can see my screen just shortly, confirm you can see the National Treasury website.
Coming up. Yes.
Now, this one, when you come to this section and you go to the budget, you're able to see that the National Treasury has put public the budget books, the budget circulars, the Mwananchi Guide, the budget policy statement, all this. So when you say budget books, what is expected in your county, when you go to budget books, for example, there's several details, and you can actually see that the budget books, like this year, you're supposed to ask your county treasury where the budget books. The budget books, when you click on this, you have several documents. You have the program-based budget that I've showed you. You have the recurrent estimates, you have developments. All these documents must be available for you to see the details. And the details must be available, including my grandmother in the village should be able to see them. So this just to answer the question that all these details are important. The second question that was asked is a policy question. Now, what happens? Every department may have its policy documents, like the policy on disability, the policy on gender mainstreaming. But I'm saying every year, the national government, what we call budget policy statement. It's called a policy statement.
We lost you a bit, Elijah.
Or you can call it a policy document.
Sorry,
So
Elijah, Elijah, we lost you at some point. Kindly, you're saying every year the policy statement something.
Are you able to get me now?
Yes, now we can hear you.
Every year, the national government develops a budget policy statement. As the national government does that, the county government develops the county fiscal strategy paper, which must be aligned to the national budget policy statement. Meaning, the Ministry of Health will tell National Treasury that mental health is a policy priority for us. Then the National Treasury will capture in the national budget policy statement that mental health is a policy priority, can resources be located. The county level, the CEC for health should meet the CEC finance and just tell the CEC finance, mental health is a priority for us. Can you capture it as a policy statement in the county fiscal strategy paper? The CEC for gender and education must say disability is a priority. So we are not saying develop policies as sectors, no. The fiscal strategy paper is an annual policy process. So there'll be need, I don't know, some we don't have time, but I think there'll be need to separate, maybe to do a session on policy development and what we call departmental administrative policies and what are the policies that require to be anchored in law. Then you separate the normal sectoral policies from what you're saying. Then the question that was raised is around the process. Yes.
When you're at that, you say that unless these things are in the 10-year, the 5-year plan, then it becomes difficult to put them in the county annual fiscal policy. So now that we know mental health and mental disability are not in the Meru County 10-year and 5-year, what option do we have?
You have two opportunities. The first opportunity, the national government is developing what we call the 4th medium-term plan, because we are approaching election, and that will be the 5-year plan of the new government. As it does that, the county government will be developing the 3rd county integrated development plan. The process for developing those plans has already begun. So that first opportunity I'm mentioning is that the technical experts of mental health must quickly meet with the county planning office for you to be given guidelines for developing the county integrated development plan. But I can still send you some of those guidelines. Then the technical experts of mental health must begin to shape the 5-year plan for the county. The second opportunity is, because the first 10-year sectoral plan, it was envisioned that the first 5 years of government and the second 5 years ending, there's a likelihood of the county governments developing a 10-year sectoral plan. So make sure you meet the county CEC responsible planning. Ask 2 questions. Where are the guidelines for county integrated development plan for the next 5 years? And where are the guidelines for the county sectoral plans? Take those guidelines. Planning is a process. It might take even 6 months and influence the next phase. Those are, for me, are the 2 critical opportunities. Then once you summarize the context issues in Meru level, then you're able to come to the national level and also present those priorities to the national team developing the 4th medium-term plan, because there's a possibility that some county context issues, upon being anchored in the national plan, then you can get what we call conditional grants to address specific mental issues, but that depends on how you present your case. So those for me are 2 opportunities for planning, because once you start planning, the budget will just sort itself. However, for the remaining 1 year, the only opportunity is to look at whether you can achieve anything in the county fiscal society paper. If you can't, then we just conclude it's not possible, but it requires a lot of negotiation with the CEC finance and CEC planning. Did I clarify?
Thank you. Thank you very much.
Yes, then the other bit that I need to clarify was a question around the entry points and the process. You know, I'm assuming that the people I'm speaking to are all involved in the sector working group. And let's separate our involvement from the public involvement. So what you must do, make sure within the health sector working group in the Meru County, you have a subcommittee specifically for mental health and disability. But because disability is in other departments, you can have a county technical team that brings government officials and civil society together, and you can call it a county technical team on disability and mental health. That technical team must quickly do sort of like a baseline survey or an assessment, so that you put on the table the disability situation in the country, in the county, or the mental health situation in the county. That will give you evidence to present your case that you require more resources. So without a baseline information, without an assessment being done, without a context analysis, most experts will not see the issue you are raising as a priority. But that's a technical process. Once you have that baseline done, remember the CIDP for the next 5 years and the sectoral plan will require outcomes, indicators, and baseline value. So that for me is something we really need to do. You also may want to sensitize the county executive committee member. I think there could be only 10 people on what disability mainstreaming and mental health mainstreaming will mean, because the county executive committee understands that you're good to go. And another opportunity, make mental health and disability a political agenda. We are going into elections. Let MCAs who want to be elected, or whoever wants to be elected, to commit on what they're going to do for disability and mental health. So if you make mental health and disability a political agenda, they are likely to achieve more. But that's more of a technical process. The public process, ideally, devolution and vision that we are going to have a ward development plan, even before you get to the county integrated development plan. So the reason why we have a ward administrator and an MCA is because they can have a conversation at the ward level and have their ward development plan. And the word integrated means at the county level, you integrate the national plan and the county plan, but you sort out whose function is it to do what. When you go to the ward level, develop a ward integrated development plan. So if citizens come together, they develop their ward integrated development plan, already their priorities will find space in planning and they don't have to wait for budgeting. What it means, if you have a ward development plan, anytime someone comes to you for public participation, they're telling you to raise your views, you object and say, we already developed a ward development plan, we costed it. Before you tell us to tell you new priorities, give us evidence that you're implementing previous priorities. I think that's what I can say for now, but I feel like the 1 hour was not enough because part of the questions being asked here require that I make references to case studies from other counties that I know are doing some of these things. Thank you, and back to you.
Wow, thank you. There are some colleagues here from CBO. I want to see if they have any question. Japhet, kuna swali yote? Sijui kama tumeelewa kwamba if I just try and summarize some key issues, when you allow me to do that before you exit. Let me use uchimbuo watu kidogo. Tumeelewa kwamba pesa ya serikali inakuliwa katika mipango, haikuliwi kwa banki. Umesikia hiyo? Okay. Na inamaanisha kwamba kama lile jambo ambayo umeipatia kipaumbele haijaingia katika mipango za serikali, hata usimame ulale kwa barabara ufanye nini, hakuna kitu tutafanya. Kwa hivyo ile ambayo imetuleta changamoto kuhusu mental health na mental disability lazima ziwe katika mipango ya serikali. Ukweli iliyopo ni kwamba kwa saizi Meru County Government mipango ambazo ziko hazijaipatia kipaumbele mambo ya mental health. Unaelewa? Na ukijaribu kuangazia zile miaka kama 3 zilizopita, budget ya serikali hakuna pesa imewekwa ambayo inaweza kusaidia. Na najua Jennifer ama Rafa kwamba kati yenu katika wanachama wenu kuna wale ambao wamejaribu kupeleka watoto katika shule, na zile shule ninyi wenyewe mlikuwa mnaeleza mtoto ameenda karibu miaka 12 na baada hawezi kusema jina lake. So lazima tuangazie, na kuna zile pia occupational health. So I think what we need is to be able to map out all these services that are required and therefore see how we can advocate for them. So, but there's still an opportunity, and for this year, we all must focus on the county fiscal paper. Na hiyo policy document ni nyinyi kama wale ambao wanasikia uchungu kwa kiatu. Make sure muongee from the ward level, MCA hawezi kuwa ndiye anasema. Kama MCA ataongea, itasikika kwa sisi. Na itawekwa. So it's possible. But
maybe some,
yes.
Some were on it. Are you seeing the screen?
Yes.
So it's important that as you speak around these opportunities, this is the current Meru County circular, 23rd August. And I want to show you, for those who do not have it, some maybe you can share with them. This document already has specific dates. And those dates, you might miss the opportunities if you don't engage at the right place. So you need to already see what it's saying. It is telling us program performance reviews is to be done. In undertaking program performance reviews, departments are expected to undertake a detailed assessment. So this is what we're saying. If you don't do a detailed assessment of mental health situation and disability, then you're still losing it. The assessment should entail analyzing the previous budget, allocations, and achievements and all this. So you have some work to do if this has not been done. Then see further how resources are to be given. They're saying county treasury will ensure there's rationalization of expenditure. in order to ensure that funded programs are in line with the Vision 2030, CIDP, ADP, and medium plan. This is what I was telling you. Then the last one, look at what they're saying, the fiscal strategy paper. They are talking about the county shall closely monitor economic impact to ensure that they align the fiscal plan to the changing context. So you need to read this to know exactly what the Treasury is guiding departments to do. This is what they're looking at in terms of resource allocation, fiscal sustainability, budget ceilings. You know, the expected output and outcome. So if you cannot present what mental health program is in terms of outcome and output, you will not get money. The expected output and outcome of the program and the linkage of the program has with other programs. For example, you must show how mental health is linked to agriculture or food security or education, then you are going to succeed. So the guidance on how the money is to be allocated by Meru County is already here. You know, then you are told now to cost. You are told you should not allocate money for interns, for example. This is just guidance that you need to be aware of. So because some of this document, I'm sure participants you can print for them, and then they should be able to read. But most importantly now is the dates. So the dates, there's a section here for the dates. I think we're just about to get it.
Great.
Yes, it is here.
Okay.
So maybe one of the dates that is critical for us, if you see the opportunity for the next 1 year sum, you can see 21st September, bado haijafika, ni Tuesday. So between now and Tuesday, this is what's happening. Setting of baseline policy priorities. By Tuesday, please push to ensure that mental health is included as a policy priority. Because if Tuesday ikipita 21st, then hiyo kitu haitachukuliwa. The next one where you need to push for is a county fiscal strategy paper, which as you can see here, the date for Meru County fiscal strategy paper is 5th of December. So you have some 3 months to push for disability inclusion and mental health with the fiscal strategy paper. So some you can share this later on with participants. Otherwise, I thank you very much for listening and have a good afternoon. Back to you, Sam.
Thank you. Thank you, Elijah. We appreciate it. I'm sure we'll need another session with this team, maybe even come down here and meet people as they work on that. Otherwise, thank you very much, Elijah. Okay, thank you.
Am I allowed to log off now?
Yes, it's okay. Thank you.
Thank you and have a good afternoon.